This milestone is a testament to the dedication and hard work of our healthcare workers, partners, and communities who have come together to protect vulnerable populations from these debilitating diseases. Through this campaign, we've not only saved countless lives, but also taken a significant step towards a healthier, more resilient future. The World Health Organization has long emphasized the importance of vaccination in preventing outbreaks and controlling the spread of infectious diseases. Our efforts have been guided by the principles of equity, accessibility, and community engagement. The numbers speak for themselves. Millions, over 20 million people of individuals vaccinated, communities empowered, and a significant reduction, hopefully, in the reported cases of measles, yellow fever, and HPV. This success story wouldn't have been possible without the tireless efforts of our frontline workers who have braved challenging circumstances to reach remote and underserved areas. We're also grateful for the support of our partners who have provided critical resources and expertise to bolster our response. We must continue to strengthen our systems, improve vaccine access and uptake, and address the root of causes of vaccine hesitancy. The outbreak response will hold between Saturday 28th to Tuesday 22nd of January 2025. And it's very, very important to thank you all, because we do need the press to actually spread the word. That's where we create more awareness. There is still a lot of work to be done. We hope the next time we go through campaigns like this, we're even going to get larger numbers.
The Lagos State government commenced the year 2024 measles and yellow fever and, of course, HPV vaccination campaign on the 19th of October 2024. The Integrated Supplemental Immunization Activities, SIA campaign, was a landmark public health intervention that was aimed at addressing the gaps in immunization coverage and curbing the spread of vaccine-preventable diseases in Lagos State. This comprehensive campaign targeted measles, yellow fever, and the human papilloma virus, prioritizing high-risk populations and leveraging innovative strategies to maximize impact by focusing on both urban and remote communities. The campaign sought to achieve herd immunity, reduce disease transmission, and strengthen routine immunization systems. So the campaign was phased into two. The first phase covered densely populated areas with a higher burden of disease, while phase two focused on less populated areas in the state. Each of the phases spanned 14 days, followed by dedicated mop-up activities to ensure no eligible individuals were missed. This strategy was complemented by extensive community engagement, robust monitoring mechanisms, and integrated service delivery. At its core, the campaign aimed to vaccinate all eligible children and adults, achieve operational excellence, and foster community trust. Advocacy, social mobilization, and the use of the conventional and social media were central to its implementation. Advocacy visits to our traditional leaders, a lot of our obas were part of our working group. Religious leaders, both Christian and Muslims, were also part of the working group for this immunization. We also had people from the market women, market leaders were also part of this working group. So it was something that involved the whole community. So we had town hall meetings, we had house-to-house campaigns. All this played a critical role in building trust and ensuring community participation. The use of social media influencers also was instrumental to the success of this campaign, as well as our media. You that are with us here today, you played a very pivotal role in ensuring the success of this campaign. Additionally, GIS-based microplanning, strategic staggering of campaign and innovative cold chain management, optimized resource allocation, and operational efficiency. The campaign delivered and achieved significant milestones. 3,955,461 children were vaccinated against measles, representing 85% coverage. These are children between the age of 9 months and 59 months. 20,366,405 Lagosians received the yellow fever vaccine, achieving a 95% coverage. The yellow fever vaccine was for individuals from the age of 9 months to 44 years, and we did more than 20 million of that. So let's clap for Lagos State once again. For the HPV vaccine targeting 9 to 14 years, we were able to vaccinate a total of 163,555 individuals. And we will have done more than this, but for the fact that we ran out of vaccines throughout Nigeria. So key lessons from this campaign include the critical role of high-level advocacy and stakeholder engagement in driving public health initiatives. Data-driven decision-making and community-led mobilization strategies emerged as effective tools for improving vaccine acceptance and coverage. In conclusion, the 2024 Integrated SIA campaign exemplifies the power of partnership, innovation in advancing public health goals. Its success underscores the importance of sustained political commitment, community engagement, and data-driven approaches in addressing the persistent challenges of vaccine-preventable diseases. So this success is a significant milestone in our ongoing effort to protect the health and well-being of Lagosians. And let me make boast that this exercise that we had is the best that has ever happened in the history of public health campaigns of vaccination in Nigeria. Measles and yellow fever and, of course, HPV are serious, potentially life-threatening diseases, and this campaign played a crucial role in ensuring that our community and our people are safe. Let me once again thank Mr. Governor. Let me also thank the First Lady for their unwavering commitment and their support in ensuring that we had a very successful outcome for this campaign. The Honorable Commissioner for Health, the Special Advisor to Mr. Governor on Health, and of course our Permanent Secretaries, Permanent Secretary, Minister of Health, and the Permanent Secretaries of Health District 1 and 2. They all worked tirelessly to 1 to 6, sorry, Permanent Secretary, Health District 1 to 6. They all worked tirelessly in ensuring that this campaign was a success. And of course, our health workers, our directors, our dedicated health workers in the primary healthcare sectors, who worked tirelessly in reaching every corner of the state and ensuring that every eligible individual received the necessary vaccination. I say big thank you to you. Our invaluable partners, including international organizations, NGOs, community-based organizations, WHO, UNICEF, Govt, BMGF, CDC, AFNET, USCDC, CHI, JSI, MRIght, ACASOS, Help Mom, eHealth, Grid 3, Save the Children International for their technical and financial support, and then, of course, their collaboration in ensuring that the campaign had this very big impact. I would like to also appreciate the citizens of Lagos State for their active participation and cooperation in making this campaign a success. In many of our vaccination centers. People came out, they brought their children, they brought themselves, and they said, we want to take these vaccines. This is actually a turning point in the history of vaccination in Lagos State.